Before we begin, if this is the first time you visit to our channel, you consider to subscribe. Trust Doctor Channel. Dr. Ez. Obsessive compulsive disorder (OCD) is a common mental health condition where a person has obsessive thoughts and compulsive behaviors. OCD can affect men, women and children. Some people start having symptoms early, often around puberty, but it usually starts during early adulthood. OCD can be distressing and significantly interfere with your life, but treatment can help you keep it under control. Symptoms of obsessive compulsive disorder (OCD). If you have OCD, you'll usually experience frequent obsessive thoughts and compulsive behaviors. An obsession is an unwanted and unpleasant thought, image or urge that repeatedly enters your mind, causing feelings of anxiety, disgust or unease. A compulsion is a repetitive behavior or mental act that you feel you need to do to temporarily relieve the unpleasant feelings brought on by the obsessive thought. For example, someone with an obsessive fear of being burgled may feel they need to check all the windows and doors are locked several times before they can leave their house. Women can sometimes have OCD during pregnancy or after their baby is born. Obsessions may include worrying about harming the baby or not sterilizing feeding bottles properly. Compulsions could be things such as repeatedly checking the baby is breathing. Getting help for obsessive compulsive disorder (OCD). People with OCD are often reluctant to seek help because they feel ashamed or embarrassed. OCD is a health condition like any other, so there's nothing to feel ashamed or embarrassed about. Having OCD does not mean you're mad, and it's not your fault you have it. There are two main ways to get help. Refer yourself directly to a psychological therapies service. Find a psychological therapies service in your area. See a GP, they'll ask about your symptoms and can refer you to a local psychological therapies service if necessary. You can also find mental health apps and tools in the NHS apps library. If you think a friend or family member may have OCD, try talking to them about your concerns and suggest they get help. It's unlikely OCD will get better without proper treatment and support. Treatments for obsessive compulsive disorder (OCD). There are some effective treatments for OCD that can help reduce the impact it has on your life. The main treatments are psychological therapy, usually cognitive behavioral therapy (CBT), which helps you face your fears and obsessive thoughts without putting them right through compulsions. Medicine, usually a type of antidepressant medicine called selective serotonin reuptake inhibitors (SSRIs), which can help by altering the balance of chemicals in your brain. CBT will usually have an effect quite quickly. It can take several months before you notice the effects of treatment with SSRIs, but most people will eventually benefit. If these treatments do not help, you may be offered an alternative SSRI or be given a combination of an SSRI and CBT. Some people may be referred to a specialist mental health service for further treatment. Causes of obsessive compulsive disorder (OCD). It's not clear what causes OCD. A number of different factors may play a part, including family history. You're more likely to develop OCD if a family member has it, possibly because of your genes. Differences in the brain. Some people with OCD have areas of unusually high activity in their brain or low levels of a chemical called serotonin. Life events. OCD may be more common in people who have been bullied, abused or neglected, and it sometimes starts after an important life event, such as childbirth or a bereavement. Personality. Neat, meticulous, methodical people with high personal standards may be more likely to develop OCD. Also, people who are generally quite anxious or have a very strong sense of responsibility for themselves and others.